Many people are struggling with stress during COVID-19. Understandably, there are a myriad of challenges and uncertainties that people are facing. Will I contract the virus? How safe is it to go out? Will my loved ones get sick? Can I even be with my family if they're sick? Or if a loved one dies, what do I do? What happens if I lose my job and I can't make ends meet? How do I manage online schooling for my children? This can be complicated by living in a crowded house or apartment and there's no space for anybody to do their work. Or if the children don't want to go to do the schooling online. We have lost social connections. What if I can't go to proms or parties or graduations or weddings? All of these uncertainties lead to a sense of fear and isolation. The stress can surely result in anxiety and depression. Some of these feelings can emerge in anyone during challenging times, but for people who have underlying psychiatric and addiction problems, they are especially vulnerable. Depressive symptoms that you can look for include decreased energy, getting out of bed, changes in eating and sleeping patterns, sense of hopelessness, not motivated, not enjoying anything anymore, tearfulness all day, isolating from friends and family, and even suicidal ideation. Anxiety symptoms can be overwhelming as well, including fearfulness, excessive worrying, compulsive cleaning, inability to stop your mind from racing along. I can't stop worrying, I can't relax, I can't concentrate, or thoughts that people might have. It is understandable if people seek out drugs or alcohol to self-medicate these disturbing and scary feelings. People who already struggle with addiction are vulnerable to increased cravings and relapse. Some drugs and alcohol patterns to look for may include starting to use drugs again after not using for many years, using all day long, trying new drugs to feel better, such as heroin or sedatives or even alcohol just to calm down or go to sleep, or using cocaine to get out of bed, going to dangerous and unsafe places without masks to pick up drugs, feeling out of control of drug use and unable to stop. Financial problems start to flow from the drug use. This can surely create tension with your family around the drug use, or if you're not even able to go to work or school, even if you're supposed to be working remotely. Increased guilt and shame from the drug and alcohol use may result in further isolation. The most important thing to know is that you are not alone. There is help for people with addiction and co-occurring emotional symptoms. Treatment can make a big difference. We are thankful that due to technology, we have been able to continue treating patients with virtual health through telephone and video visits. People have access to many modalities of services, including counseling, individual and group therapy, medication management, both for their addiction as well as their emotional problems. These medications may include Suboxone, methadone, antidepressants, medications for anxiety. We have a wide array of clinicians in our treatment settings, including social workers, psychologists, psychiatrists, vocational counselors, and even have integrated primary care in our programs. We have found that patients who are already engaged in treatment are doing so much better than one would have imagined during the pandemic. The access to virtual health decreases their sense of isolation and provides hope and perspective about the road to recovery during uncertain times. So if you already have a treatment provider, please reach out for continued care. If you do not have a treatment provider, please know that there are many treatment options available from your home. Whether you seek help from our vast continuum of treatment services that we provide at Montefiore Health System or through another provider, I encourage you to seek help. Treatment makes a difference.